I don't think there's an easy procedure under the umbrella of plastic surgery, and I think it's and I'm sure has been your experience too. It's like when you're a trainee, you're looking at your mentors do things and it just looks super smooth and super easy. And you're also pretty detached from the aftercare, right? You're not privy to, all of the nuances in terms of, patient management and patient dissatisfaction and like what goes on after patient gets off the operating table. So, I think you learn that the hard way coming out, and sort of having a patient roster of your own and realizing just how difficult it is to achieve success and sort of hit the bullseye when it comes to procedures that, are fully elective. Patients are of their own volition opting to have. Nobody wants surgery, right? If there was a magic wand that can just deliver the outcome a patient is looking for, patients would choose the magic wand, Nobody wants a scalpel. But yeah, to your point about the nose, it is, the smaller the structure, the more intricate it is, right? Think of a watch. Think of a watchmaker, okay? There are people that dedicate their careers to working in this, like, what is it, 1.5 by 1.5 space. And I feel like rhinoplasty has a lot of parallels to that. It's unforgiving. It's obviously like a projecting structure in the midline in the center of your face. So I use the analogy of a sofa in a living room, right? If you don't like the decor, probably has something to do with the sofa. You can't, and if the sofa totally stands out like a sore thumb, you're probably not going to like the way the living room looks at all, right?
It's a great